And in Lane County, there's a new task force focused on emergency response. In a unanimous vote yesterday, the Lane County Board of Commissioners approved the new task force to tackle financial challenges facing emergency medical services in Lane County and to come up with sustainable solutions. KVAL's Gold Meadows has the details.
A joint elected task force made up of the 5 fire chiefs in Lane County and elected members selected by city mayors and fire districts gets the green light by the Board of Commissioners Tuesday. The board approved 16 members for the team tasked with looking at the current financial outlook for EMS operations in the county and come up with options for sustainable funding for the future.
Our ultimate goal is to figure out how we financially support EMS services, and certainly the existing model. If we were to maintain the existing model, we would have to think about financing that with the diversity of agencies that we have and the lack of economies of scale.
Gray is among the members on the task force, along with Lane County Commissioner Heather Buck and Eugene Springfield Fire Chief Mike Cavan.
Lane County's been facing a financial challenge for well over a decade, almost 2 decades now, since changes at the federal level adjusted how we receive reimbursements for ambulance transports. The ambulance systems are funded by user fees, and over 80% of those for us are either Medicare or Medicaid patients, so the reimbursement is capitated by decisions at the federal level.
Gray says older people on Medicare primarily use the service, but Medicaid and Medicare only pay some of patient cost. And coverage under commercial insurance is poor, so not many insured people even use the service. Gray says the federal budget, which calls for cuts to Medicaid and Medicare, could present more challenges for an already strapped system.
Depending on how quickly we see reductions in folks who are covered by Medicaid, we could see an increase in folks who are uninsured utilizing ambulance services. That could further destabilize the system. There are also some potential proposals around reimbursement for ambulance services, particularly in the Medicare and Medicaid realm. We'll certainly be watching the federal budgeting process.
While said to be in its infancy stage, the task force has 18 months to come up with potential solutions for the problem that Cavan says impacts the entire county, but ESF in particular, as it has the largest coverage area.
We run out of ambulances on a near daily basis, if not more than one time a day. What we're talking about right here is merely covering the cost to deliver the service today, which Eugene and Springfield each have their own ambulance transport system, treated like an enterprise fund, yet we provide service to the overwhelming majority of the county's residents.
The county itself is not an EMS provider, but it is responsible for oversight and assigning contracts for those providers. Cavan said there were previous task forces dating back to 2009, which led to the establishment of ESF. Reporting in Eugene, I'm Gold Meadows.
Over the next 18 months, the task force must give updates to the Board of Commissioners every 6 months.